Thyrotoxicosis or overactive thyroid. Thyroid gland is one of the most important glands of the human body which regulates several functions. The thyroid is a small butterfly-shaped gland that lies at the bottom of the neck, normally just below Adam's apple. It makes a hormone that your whole body uses, and this hormone is particularly important in the regulation of the body's energy and metabolism. Hyperthyroidism occurs when thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism is more common in women. Goiter is an enlarged thyroid gland. In goiter, the gland can be functioning normally, underactive, or overactive. Thyroid controls things like how fast your heart beats and how quickly you burn calories. It releases hormones to control your metabolism. The thyroid uses the iodine in our body to make two main hormones, T3 and T4. It primarily makes T4 and our body converts T4 to T3. This process is controlled by another hormone called thyroid stimulating hormone, which is made by the pituitary gland in the brain. Hyperthyroidism occurs whenever there is an excessive amount of thyroid hormone in the bloodstream. Causes of hyperthyroidism include Graves' disease. It's an autoimmune disease and the most common cause of hyperthyroidism. It's more likely to affect women under the age of 40. Thyroid nodules or toxic multinodular goiter. These lumps of tissue in the thyroid can become overactive, creating inappropriate thyroid hormone secretion. Thyroiditis, an infection or an immune system problem, can cause thyroid to swell and leak hormones. Other causes of hyperthyroidism include excessive intake or exposure to iodine. Other risk factors for hyperthyroidism include a family medical history of thyroid disease, a personal or family medical history of any autoimmune disease, smoking, and increased iodine exposure. Stress. Stress exacerbates autoimmune thyroid diseases. Stress can simultaneously suppress the release of thyroid stimulating hormone from the pituitary gland and decrease conversion to the more active form of thyroid hormone, triiodothyronine. Stress affects the immune system either directly or indirectly through the nervous and endocrine systems. There are various causes of hyperthyroidism because the whole body uses the thyroid hormone. A broad variety of signs and symptoms appear in the body. Common signs include the elevated levels of thyroid hormones can affect the entire body and can result in dizziness, fluctuations in weight, feeling hot, increased blood pressure, increased heart rate, and fatigue, nervousness, agitation, anxiety, irritability, experiencing mood swings. Hyperthyroidism can adversely affect your entire body. The decision making involved in hyperthyroidism is complicated, and the individual with hyperthyroidism is emotionally labile due to the elevated hormones. Sensitivity to heat, fatigue or weakness, an enlarged thyroid or goiter, weight loss with excessive hunger or increased appetite, fast or rapid heartbeat or palpitations, profuse sweating, heat intolerance, hand tremors, sleep problems, skin thinning, fine brittle hair and hair loss, muscle weakness, irregular heartbeat, diarrhea, or more frequent loose stools, changes in the menstrual cycle or irregular menstruation, abnormal blood pressure, decreased concentration. Goiter, which involves an enlarged thyroid gland that gives a swollen appearance to the neck. If left untreated, hyperthyroidism can cause serious problems with the heart, bones, muscles, menstrual cycle, and fertility. During pregnancy, untreated hyperthyroidism can lead to health problems for the mother and baby. Graves' ophthalmopathy, also known as thyroid eye disease. About 30% of people with Graves' disease get a condition called Graves' ophthalmopathy. It involves vision and eyes, including the muscles and tissues around them. Graves' disease may include eye problems such as bulging or protruding of the eyes, pain or pressure in eyes, redness or inflammation in and around eyes, eyelids that are puffy and eyelid retraction, sensitivity to light, double vision or loss of vision. Thank you.